Dr. Warren Rosenfeld, Chairman of Pediatrics at Winthrop University Hospital. As a pediatrician and as a neonatologist, a specialist who takes care of newborn babies, I've been treating babies with jaundice for over 40 years. In this video, I'm going to explain to you about newborn jaundice, why it occurs, and the problems it may cause for your baby. I will also tell you how it is currently treated and about a potential new treatment option that is currently being investigated. Jaundice is a yellowing of the skin, which is common in newborns. In fact, 6 out of every 10 babies are affected by jaundice in the first weeks of life. Jaundice is caused by a buildup of a yellow substance called bilirubin in the blood. Bilirubin is made during normal breakdown of old red blood cells, an event that occurs in every baby and every adult. When the red cell breaks apart, it releases bilirubin that circulates around the body and then is carried to the liver where it can be eliminated from the body. While all babies' livers are slow in their ability to remove bilirubin from the blood, some babies also have conditions where the blood cells are being broken down rapidly and produce higher bilirubin levels and therefore more severe jaundice. Some babies with jaundice may be more sleepy and harder to feed. While these symptoms are only temporary, permanent damage may occur if bilirubins become too high. Bilirubin can damage nerve cells, which may lead to hearing loss and brain damage. It is therefore very important to monitor bilirubin in babies so that treatment can be started if it is needed to make sure that levels do not get too high. Babies who need treatment for jaundice are normally given phototherapy. They're placed in an incubator and put under a blue light with their eyes protected. The blue light helps to break down the bilirubin into substances that the baby can remove from the blood. Phototherapy typically takes several hours or days to be effective. While your baby is receiving phototherapy, you may not be able to hold or feed him or her easily. If phototherapy does not work well enough or quickly enough, babies may need a procedure called an exchange transfusion. This is a type of blood transfusion in which the baby's blood is removed and replaced. It is only used as a treatment of last resort because it is complicated and involves some risks. The Jasmine Study is a clinical study looking at the safety and effectiveness of a potential new medication for newborn babies who need treatment for jaundice. The Jasmine Study is looking at whether giving this investigational medication called stanzoporphin in combination with standard phototherapy will lower bilirubin levels quicker than phototherapy on its own. Stanzoporphin has been given to over 850 babies as part of previous clinical studies, and babies have been followed for up to 5 years after the drug was given. The results showed that babies who received stanzoporphin had lower bilirubin levels and spent less time on phototherapy than babies who did not receive stanzoporphin for their jaundice. And these effects were seen within 12 hours after the drug was given. The present study, called the Jasmine Study, is recruiting babies who are at higher risk for having jaundice that requires treatment. When a baby's blood type and the mother's blood type are different, or what we call incompatible, the baby may develop an increased breakdown in red blood cells. This process starts even before birth inside the uterus. Another problem that causes increased breakdown of the baby's blood is G6PD deficiency. G6PD deficiency runs in families, so you may already know if your family is affected or your baby is at risk. Approximately 90 babies from 40 study centers in the United States may take part in the Jasmine Study. The first step of joining a study involves providing informed consent. Parents or guardians need to consent on behalf of their children as they cannot consent themselves. Babies with known conditions that cause higher bilirubin levels will have their bilirubin levels checked Bilirubin monitoring will continue through the study until your baby's bilirubin level no longer needs treating. All babies in the Jasmine study will receive standard blue light phototherapy if they develop jaundice that needs treating. All babies will get one single injection. Babies will be divided into 3 groups, which will be decided by drawing lots. No one, including the doctors, the nurses, or the parents, will know what their babies received. 2 groups will receive stanzoporphin, and 1 group will receive a placebo. The placebo will look the same as the study medication, but does not contain any active ingredient. It is being used to allow the researchers to compare how phototherapy works on its own or in combination with stanzoporphin. Your baby will be closely monitored and will have a number of assessments as part of the study. Most of these assessments are standard for babies with newborn jaundice, so your baby would have them whether or not they join the study. Your baby will stay in the hospital until their jaundice has decreased and the study doctor or pediatrician thinks that they are well enough to go home. They will be invited back for checkups at 7 and 30 days after the jaundice treatment to check their health, growth, and development. Babies who complete the 30-day Jasmine study will be invited to join the Jasmine follow-up study, which will look at their health, growth, and development over the next 4 years. Taking part in clinical studies is an important decision for you and your family. All medical procedures have risks, which you should discuss with your doctor. Parents may consider allowing their baby to take part in a clinical study because it provides several opportunities. It helps their baby to gain access to potential new treatment options. It helps to get more information about a disease or a condition. It gives benefit from close monitoring and a dedicated medical team. And it can help future generations of babies with the same condition as theirs. If you'd like more information about the Jasmine study, please use the contact details on the screen or visit the study website www.babyjstudy.com.